Okay, this will be your first lecture in psychology as we embark on this online odyssey, and it is chapter 17, Therapy and Change, and we're looking first at what is psychotherapy, starting on the section 1, pages 485 to 492, and if you look through this, I want you to take a look top of 486, and it defines exactly what psychotherapy is. Any treatment used by therapists to help troubled individuals overcome their problems. And typically when you're talking about therapy, you're talking about verbal interaction between the therapist and the client. And when you're talking about therapy, you talk about clients. You don't talk about patients, because what we're doing is we're treating the client as an agent of change. You know, when you go to a doctor and you're sick, you kind of just sit there and you wait for the doctor to tell you what has to be done for you to fix the illness. The doctor ends up being the change agent. In therapy, generally speaking, the philosophy is that the client is the change agent. So they're much more involved in making themselves better than a patient with a doctor typically would. If you look at our functions of psychotherapy, one of the first things to look at is that one of the primary functions is for the therapist to help the people realize they're responsible for their cure. Again, this notion that the client is the agent of change and that the client typically has the solutions within them to assist them in figuring out what those things are. Major task, if you look at the bottom of 486, the major task of therapists, therefore, is to help people examine their way of living, to understand how their present way of living causes problems, and to start living in new ways and more beneficial ways. The therapist can be thought of as a professional hired by the individual to help to help him or her find the source of their problems, and then consequently find solutions. Now, this chapter, getting into the next section, looks at the main kinds of therapy, and you'll see about 6 lines down there, it'll show psychoanalysis, humanistic, cognitive behavioral, and biological means of therapy. Flip the page, you'll see a table that describes that. That colored section. Remember? Got to be paying attention to all the sections in the text. It shows the therapy method, the main techniques, the main goals, and the means of achieving the goal. Note for I'm briefly going to go through them. For psychoanalysis, that's Freud. Using psychodynamic notions, trying to find out what the unconscious is doing to prevent people from becoming the best versions of themselves. So you have a lot of talk therapy. It's the classic notion of like a therapist and a client, although in psychoanalysis they actually call it the patient. Patient lies on the couch, and you're doing all sorts of things to try and tap into the unconscious. Dream analysis, using projective personality tests, word association, that sort of thing. Now, humanistic is also very much involved in talk therapy. Remember, we talked about that's what I was trained in. You can never say no with humanistic therapy. And I'm going to talk about that a little bit later in this particular lecture. Cognitive therapy, this is a little bit more directive than humanistic therapy. Remember the list of cognitive distortions? Such things as I have to be perfect, I can never make a mistake, I have to please everyone. These sorts of distortions always end up causing problems because they're absolutely unachievable. A cognitive therapist is much more directive with the client and getting them to rethink themselves, to get them to say, you think you have to be perfect in all things. That's not possible. You are wrong. A cognitive therapist can actually tell a client that they're wrong. Then finally, a behavioral therapist is going to be working on contingencies of reinforcement to try and get clients to change their behavior. The classic illustration of this is the phobia treatment, systematic desensitization. Okay. The goal of therapy we kind of already talked about. If you're looking at the sorts of therapists, like who are therapists, take a look at the table on page 489. Clinical psychologists. These are folks that work in clinics, and they're typically working with people who have diagnosed disorders like major depression or bipolar disorder, schizophrenia, as the case may be. Counseling psychologists can work in clinical settings. They can be working with folks that are that have a clinical diagnosis, again, like depression or schizophrenia, but not necessarily all the time. Clinical psychologists, they're working with folks nowadays. They tend to be working with folks that actually have brain damage. Psychiatrists, as we talked about at the beginning of the year, these are medical doctors. They can engage in therapy. The thing that sets them apart is they can dispense medication. Psychoanalysts tend to have higher degrees, and again, they're using Freudian methods of therapy. Typically, if you're seeing a psychoanalyst, you're going to be in therapy literally for years. On the other hand, if you're seeing a counseling psychologist or a counselor from the bottom, sometimes it could be as low as 6 weeks, particularly if you're using behavioral or cognitive behavioral methods. Psychiatric social workers, these counsel people with everyday problems so remember we were talking about working with a schizophrenic. So let's say this person is kind of maintained with medication, but they're still having problems. The psychiatric social worker is going to be working with them like on managing daily goals, for instance. Okay, you have to go to your job so you can earn money. What time do you have to get up? Do you have your alarm set? Okay, do you know what clothes you're going to wear? Do you have those laid out, or someone can help you lay them out? How are you going to get to work? How are you going to get home? What do you have to do to keep groceries in the house? What do you have to do to pay your bills? These sorts of things. Assisting folks, typically with chronic mental illness, simply to manage the day-to-day requirements of their existences. Psychiatric nurses are nurses that are additionally trained in giving therapy. And then finally, counselors at the bottom, a master's degree. This is me. They dispense advice and may or may not have any training in psychology. Mine's counseling psychology, so I do actually have the training in it. Interestingly, counselors tend to be somewhat in high demand, and they can work in any number of different fields. One of the key tools of therapists, and this would be true really for every therapist, in particular humanistic therapists, that vocabulary word at the top, page 49, empathy, the capacity for warmth and understanding. And yeah, I know, you guys look at me and think, how can he possibly have any empathy? Well, they actually can train you to do it. And believe it or not, I can show it on occasion. It's primarily to build a trusting relationship. No, it's not just primarily. It's like incredibly important that the client can trust the therapist so that the client can open up and expose their vulnerabilities to the therapist. Therapists can do this in large part through reflective listening, or what's called active listening. You're not just sitting in a chair, just sitting back and listening to what they say. You're actually actively engaged. You have body language that shows you're actively engaged. And you don't just listen. You also have to talk back. And typically the talking back is simply more or less repeating what the client said, but not in the exact words. Put what the client said back to them in your own words. In your own words as a therapist, you can use reflection, which means you're exhibiting these sorts of feelings. This is how you're feeling about this situation. Am I correct? And just in doing that, so that the client knows that someone is listening, it makes it easier for them to build that trusting relationship with the therapist and therefore actually open up. That's what it takes to build empathy. Typically when you're talking about therapy, you're talking about individual therapy, but there are some group therapies involved. I'd mentioned in class a while back, the group therapy with folks that were suffering from rather severe chronic mental illness, schizophrenia, bipolar, and so forth. And there was that woman in the group that was doing very well, and she was high functioning. And I thought she was a fellow therapist, but she was suffering from bipolar that had it well medicated, but she was going as a reminder for her of what she needed to do if she ended up going off her medication. Group therapies typically allow for folks to get together who have similar difficulties, and that serves two primary purposes. One is simply to know you're not alone in whatever situations that you happen to be struggling with, but the other is that sometimes folks have some solutions to the common problems that they're suffering from, and that sharing is a valuable thing. There's family therapy. When I worked as a school counselor, we often had kids who were having difficulty that came out of the dynamics of the home. Parents are very controlling, one parent is abusive, perhaps one parent is drinking, whatever the case may be. And if that turned out to be a continuing problem, and the child in particular was in elementary school, so they're going to be at home for quite some time, it might be good to get the family to buy into the idea of working together as a unit to make the marriage stronger, to make the parenting relationship stronger, so that consequently the kid benefits from this as well. Finally, there's self-help groups. This is kind of like group therapy, but the difference is that with group therapy, you have a therapist who's leading it. With self-help, there are no leaders. It's just a gathering of people who have common concerns, and they try to share them, typically in a semi-confidential manner. Alcoholics Anonymous is a classic example of a self-help group. There is no lead therapist. And the only real requirement for going to Alcoholics Anonymous is that A, you need to be an alcoholic, and B, you need to commit to keeping everything confidential. You don't talk about what goes on in AA meetings outside. And typically, folks in AA would simply introduce themselves by their first name and last initial, so that they can also maintain some confidentiality within the group. Does psychotherapy work? Well, in a sense, yes. If you measure people's happiness or perceived levels of functioning before therapy and after therapy, you tend to see significant improvement after therapy. The problem is you're relying on self-report data, which is kind of notoriously unreliable. But on the other hand, if the client perceives that they're doing better, then an argument can be made that they are actually doing better. Now, does this work as well as, say, for instance, medication in certain circumstances? Well, the placebo effect is a thing. And it's a thing with therapy, but it's not just a thing with like humanistic therapy or talk therapy. It's also potentially an issue with biological therapy. If you remember when we looked at statistics way back when, and we were talking about trying to make a medication to cure depression, and so you take this baseline reading of people. How are they feeling? On a scale of 1 to 5, and depressed people, they're reporting they're depressed, so let's say their average is 1.5. So you measure 100 people, and on average they're feeling 1.5. On a scale of 1 to 5, that's not very good. Then you divide the group in half. In one group you give a new medication, the other group you give a sugar pill, a placebo. So the experimental group, the one that has medication, they improve, but what happens to the folks who take the sugar pill? If you remember, yeah, they improve as well. And a sugar pill is not going to make anyone feel better. Or fine it. If you're going to say it's sugar, say it's water. It doesn't matter. If you put in a pill that technically is not supposed to have any effect, it often does. Because when a person thinks they're being treated, they tend to get better. At least with a number of illnesses. Obviously with cancer, this isn't going to work so well. And the placebo effect very much applies with therapy as well. So, that will end this first lecture that you're getting in psychology. You're going to have a number more between now and whenever this plague spring ends. We're going to have a combination of these sorts of YouTube videos and hopefully video conferencing so you can stay up on things. And that'll do it. Your next video will be section 2. Talk to you later.